Imagine walking into a room, right, with just 8 complete strangers.
Mm-hmm.
You take a seat in this circle of, like, identical chairs. You have no idea what their names are, their professions, or even where they came from.
Yeah, it's a completely blank slate.
Exactly. Yet, within a matter of weeks, you will know their deepest, most guarded secrets. I mean, you'll know the exact shape of their childhood traumas, the specific architecture of their insecurities, their hidden resentments toward their families.
You're going to see them weep.
Right. And they're going to see you rage. And structurally speaking, relying on those 8 strangers is statistically proven to be one of the most effective ways to heal your own mind.
Which is wild to think about.
It really is. Like, why does the human brain require a collective, often completely chaotic group to heal these profound individual wounds?
Well, I mean, it challenges our entire modern conception of mental health, doesn't it?
No, absolutely.
Because we live in this era that treats, psychological distress like a broken bone on an X-ray. It's treated as this highly individualized, binary problem that requires a completely individualized clinical solution.
Right. You sit alone in a room with one clinician.
Exactly. Or you follow like a solo meditation protocol on an app, right? Just attempting to optimize your internal state in a total vacuum.
Yeah.
But that approach completely ignores a fundamental evolutionary reality. Our psychologies, they were forged in groups, they are injured in groups, and therefore they fundamentally must be repaired in groups.
Okay, so let's unpack this. Our mission for this deep dive is to basically dissect a massive stack of foundational literature. We're looking specifically at the masterworks of Gerald Corey and Irvin Yalom, right?
Mm-hmm. The heavy hitters.
The heavy hitters. And we want to uncover the hidden architecture of group work. So we are going way beyond the surface level definitions to understand the actual mechanisms of change here.
Right, the actual gears turning.
Exactly. When you put a group of fractured people in a room, how does that collective organism develop and regress and ultimately rewire the neurobiology and the self-concept of the people sitting in those chairs?
And what's really fascinating here is that when you dive into Yalom and Corey, you realize you aren't just reading like a manual of therapeutic techniques.
What are you reading then?
You're reading a field guide to human societal dynamics. A therapy group is not just a collection of individuals taking turns getting individual therapy while everyone else just, politely watches.
Right, it's not a spectator sport.
No, it's a living, breathing organism. It basically serves as an intense microcosm of society, the real-world dysfunctions, the prejudices, the survival mechanisms of every single member. They all play out in real time right there in the center of the circle.
But I mean, before we can dissect how that organism heals, we have to look at the clinical friction inherent in even setting it up.
The logistics, yeah.
Because a leader has to make these profound structural decisions before the first chair is even placed in the room. If you walk into a clinical setting, you're going to see wildly different models.
Definitely.
Specifically, we need to look at the divide between group counseling and group psychotherapy, right?
Yeah.
Because they're not the same thing.
Not at all. I mean, if we look at the depth of the intervention, counseling groups are generally geared toward growth, prevention, and situational crises.
So it's more present-focused work.
Exactly. Conscious, present-focused. A counseling group is dealing with a temporary developmental hurdle.
Like what? Give me an example.
So you might have a group of college freshmen experiencing severe transition anxiety, right? Or maybe a group for adults navigating recent divorces.
Yeah.
The focus is very problem-oriented.
Okay. Right.
The members are utilizing their existing ego strength to navigate a specific external stressor. They aren't looking to completely deconstruct their personality.
Yes.
They're just looking to mobilize their internal resources to, get over a specific wall.
So it's akin to taking a car in for a highly specialized tune-up, right? Like you're getting ready for a treacherous stretch of road. You aren't replacing the engine, you're just optimizing what is already under the hood.
That's a perfect analogy.
But then group psychotherapy, on the other hand, that is the total transmission rebuild.
Yeah, that's where things get intense.
We're talking about deep re-education, pulling back the floorboards on both conscious and unconscious awareness.
Yeah.
Yeah.
If we connect this to the bigger picture of clinical intervention, psychotherapy groups are where you find individuals who are wrestling with, severe emotional disturbances or deeply ingrained neurotic patterns.
Or heavy trauma.
Exactly, the long tail effects of severe trauma. The leader in a psychotherapy setting is intentionally utilizing techniques to induce regression.
Wow. inducing regression on purpose.
On purpose, yeah. They want the members to tap into latent unconscious dynamics. They want them to essentially re-experience repressed traumatic situations right there in the room so that a fundamental restructuring of the personality can actually occur.
I mean, that sounds incredibly destabilizing.
Oh, it is inherently destabilizing work, which is why it requires a much, much longer-term commitment than just standard counseling.
Right. And then sitting adjacent to those two, we have psychoeducational groups and task groups, which kind of shift the locus of attention entirely.
Skew, yeah.
If psychotherapy is the engine rebuild, psychoeducational groups are like, reading the driver's manual together.
Right, they're highly structured.
Very manualized, strictly curriculum-driven. So this would be like a cognitive behavioral group for substance abuse relapse prevention or an anger management class, right?
Exactly. The leader is essentially an instructor imparting specific, measurable skills.
And then task groups remove the internal focus completely. The group only exists to solve an external problem, like, I don't know, a hospital committee changing a triage policy.
Yeah, in a task group, the internal group dynamic is only really relevant if it actively gets in the way of completing the task.
Yeah.
But, regardless of whether you are running a short-term counseling group or a deep psychotherapy group, the leader faces the structural paradox right out of the gate, and that is membership.
Oh, right. Do you lock the doors or do you leave them open?
Exactly. A closed group operates with a strictly fixed membership. You start with 8 people, you end with 8 people.
And if someone drops out in month 2?
Their chair remains empty for the rest of the duration.
Which creates an incredibly pressurized, secure environment. I mean, if I know that the exact same people are going to be sitting across from me every Tuesday for the next year, the depth of trust I can build is massive.
It's unparalleled.
But the clinical vulnerability there is pretty obvious. Because if you lose 3 people to attrition, the group energy just becomes anemic. You're trapped in this decaying orbit.
It completely threatens the psychic equilibrium of the group. But then look at an open group, right? Where new members are integrated as old members graduate or drop out. That introduces a totally different kind of clinical friction.
Because every time a new member enters, the group is violently yanked back to the initial stages of trust building.
Exactly. Think about the countertransference happening there. You have a group that has spent, let's say, 6 months bleeding together.
Right.
They've finally reached a stage of profound, unguarded intimacy. Then, on a random Tuesday, a complete stranger walks in.
The existing members must feel an intense resentment. I mean, they're mourning the loss of the group's prior intimacy while simultaneously projecting all of their suspicion onto this new arrival.
That is precisely what happened, and the leader has to metabolize all of that right there in the room.
That sounds exhausting.
It is. The existing members will often unconsciously collude to ice out the new member, or they might subtly punish the leader for altering their safe environment.
Wow.
But Yalom points out that this is exactly why open groups are so powerful. Because they mimic the ruthless reality of actual life.
Oh, because in the real world, people enter and exit our lives without warning.
Exactly. We suffer losses. We are forced to adapt to new personalities constantly. An open group forces members to continuously practice that integration and boundary setting in real time.
That makes a lot of sense. And I guess it's the same logic behind the choice between homogeneous and heterogeneous groups.
Right.
Because if you build a homogeneous group, say, exclusively adolescent children of alcoholics, you get this explosive, immediate sense of cohesion. The you get me factor is just instantaneous because the surface level identification is completely frictionless.
Yes, but that frictionless environment has a hard ceiling.
How so?
Well, for short-term symptom relief, homogeneity is excellent. But for long-term interpersonal reconstruction, Yalom and Corey heavily favor the heterogeneous group.
The true microcosm of society.
Exactly. You want a mix of ages, genders, socioeconomic backgrounds, and psychological presentations.
Because you need the friction of difference.
Right. Think about a young man whose core issue is this deeply rooted hostility toward authority figures. If he's only ever placed in a group with other young, hostile men, what's going to happen?
They'll just validate each other's pathology. Yeah, the world is out to get us.
Exactly. But in a heterogeneous group, that young man needs to sit across from a 60-year-old woman who triggers his mother issues, or a corporate executive who reminds him of the boss he just assaulted.
So his real-world triggers are activated right there in the chairs.
Exactly. And this actually raises a really important point about the historical roots of this work.
Right.
Because we can trace this emphasis on interpersonal friction back to the T groups.
Oh, the training groups from the 1940s, right.
Right. And what's interesting is these were not initially designed for psychiatric patients at all.
Wait, really? Who are they for?
They were designed for normal individuals, business executives, clinical interns, educators who wanted to understand the mechanics of group dynamics and their own interpersonal impact. It was essentially the birth of sensitivity training.
Right. And it was ruthlessly focused on the present moment. I remember the literature cites this incredible example of a T group where this participant, Robert, who rarely ever speaks, finally raises his hand and asks the group, "How can I help the other silent members participate more?"
Oh, I love this example.
And instead of validating his attempt to help, the entire group immediately turns on him and just attacks him for his profound hypocrisy, because he is literally the most silent person in the room.
It's a brutal illustration, but it perfectly captures the T group ethos. In a traditional psychoanalytic setting of that era, a therapist might spend, years analyzing why Robert is silent.
Tracing it back to a domineering father or childhood neglect or whatever.
Right. But the T group didn't care about Robert's past. They cared about how Robert's current behavior was manipulating the current room.
Because by projecting his own problem onto others, he was avoiding his own vulnerability.
Exactly. The group held up this harsh, immediate mirror to his behavior. They forced him to reckon with his actual impact on the collective, rather than his internalized historical narrative.
And we actually see this kind of community-based reflection historically in other cultures too, don't we? Like,
Right.
this wasn't just a purely Western invention, this idea of the group holding up a mirror.
Oh, absolutely not. I mean, if we look at the history of group work globally, look at India, for example.
Right.
Group work in India has this incredibly rich, unique history because the cultural fabric there has always been deeply rooted in primary groups.
Like the joint family system.
Exactly. The joint family, the local community, or panchayat. Healing was inherently a group process long before Western clinical psychology introduced formal group psychotherapy.
So when formal group counseling was introduced in India, he wasn't starting from scratch.
No, it was adapting to these deeply ingrained secondary groups and societal structures. The transition to clinical group work in India often leaned heavily on that existing community orientation, which naturally emphasizes cohesion and collective responsibility over strict Western individualism.
It is fascinating. It just goes to show that human beings, regardless of culture, default to the group for regulation, which perfectly transitions us from the structure of the room to the actual mechanisms of healing occurring within it. Because understanding that a group is heterogeneous or open doesn't explain how it cures a depressive episode, right?
Right. The structure isn't the engine.
Exactly. Irvin Yalom outlines these mechanisms of healing the therapeutic factors. And rather than just listing them out, we need to look at the psychological mechanics of why they actually work.
Let's do it.
Let's start with universality, because it seems to fundamentally alter the neurobiology of shame.
Well, think about it. Shame is inherently isolating. When someone enters a psychiatric or therapeutic setting, they almost universally operate under the assumption of unique brokenness.
Meaning they think they're the only ones dealing with this.
Yes. They believe their specific intrusive thoughts, or their bizarre compulsions, or their profound feelings of inadequacy are entirely singular to them. And this isolation breeds a toxic self-stigma that makes therapeutic movement almost impossible.
You feel like you're living on a deserted island, convinced you're the only mutated human left.
Exactly. And then you walk into a group, and someone across the circle voices the exact terrifying thought you've been having in the dark at 3 a.m.
Oh, man. That realization, it isn't just comforting. It's structurally shattering to the ego's narrative of isolation.
Yalom uses the word remoralization. The shame begins to literally dissolve because the pathology is suddenly shared.
Right. But here's where it gets highly complex, and this brings us to the next factor.
Yeah.
Altruism.
Yes. Altruism is fascinating.
Because universality relies on receiving validation, right?
Yeah.
But altruism flips the economic model of therapy entirely.
Right.
In individual therapy, the client is exclusively a consumer.
Always. The therapist provides the insight, the care, the unconditional positive regard, and the client consumes it.
Which kind of reinforces a dynamic of dependency.
It does. It reinforces perceived deficiency.
But I have to push back on this exact point, because it feels completely counterintuitive to the selfish nature of suffering.
What do you mean?
Well, if my life has collapsed and I am paying a clinician to fix my deep-seated trauma, why does giving advice or comfort to another member in the group actually facilitate my healing? I'm not there to be a therapist. I'm there to be saved.
And you are touching on the exact paradox that makes group work so potent.
Okay, explain it to me.
When a person is deeply depressed or traumatized, they have internalized a state of learned helplessness. They view themselves as a burden, a void that must be filled by others.
Right.
But when they are placed in a group and they suddenly find themselves offering a profound insight to another member, or just offering a tissue and a moment of genuine empathy to someone who is sobbing, a radical cognitive dissonance occurs.
Because they're acting entirely outside their self-concept of worthlessness.
Precisely. They realize in real time, wait, I am not just a damaged vessel requiring repair. I possess the immediate capacity to be profoundly valuable to another human being.
Well,
This act of altruism shifts their self-concept from victim to benefactor. It proves to their own ego that they still have utility, which is a massive leap towards psychic healing. You basically heal your own internal deficit by experiencing your surplus in relation to someone else.
that is incredible. So we have the dissolving of shame through universality, the rebuilding of self-worth through altruism, but then we hit the absolute core of psychoanalytic group work,
There we go.
the corrective recapitulation of the primary family group.
It's a dense phrase.
It is a very dense phrase, but the mechanics are astonishing. We are talking about the inevitable gravitational pull that forces a group to recreate the exact toxic family dynamics the members grew up with.
Well, if we look at the foundational architecture of the human mind, our family of origin is our very first group.
Our primary group.
Right. It writes the source code for how we view authority, intimacy, rivalry, love, all of it. And for most people sitting in a therapy group, that source code was deeply corrupted. So when you put them in a room with a leader who naturally assumes a parental transference role and peers who naturally assume sibling roles, the unconscious mind cannot help but run the old script.
Let's ground this in a specific detailed scenario so we can really see it.
Okay.
Imagine we have a member named David. In his family of origin, David was the invisible middle child.
A classic dynamic.
Right. His older brother was a highly volatile addict who consumed all the parents' attention. So David learned that the only way to survive was to be hyper-accommodating, to have no needs, and to silently manage the physical environment to prevent chaos. How did that manifest in the group setting?
Within 3 sessions, David will invariably recreate that exact role.
Really, that fast?
Oh, easily. Before the group officially starts, David will be the one adjusting the chairs. He'll make sure the tissue box is perfectly centered. And if 2 other members, his new siblings, start arguing aggressively, David will immediately step in.
He'll try to diffuse it.
He'll crack a joke. He'll change the subject. He will entirely abandon his own emotional agenda for the day just to pacify the room. He is unconsciously turning the therapy group into his childhood living room.
But wait, if he's just repeating his trauma response, how is that therapeutic? I mean, he's just performing his pathology for a new audience.
This is where the word corrective in that dense phrase becomes vital.
Okay.
In his childhood, David's behavior went completely unexamined because the parents needed him to be the invisible peacemaker. But in the group, the therapist and the other members act as an active, interpreting mirror.
So they don't just let it slide.
Exactly. The therapist won't just ask David about his childhood. They will stop the group and point to the here and now behavior. The leader might say, David, I noticed that every time John and Sarah disagree, you physically lean forward and change the subject. You're managing the room to protect us from conflict.
And then what?
Then they ask the crucial question. What would happen if you just sat back and let them be angry?
Wow. So you block the ingrained survival mechanism in real time.
Yes.
You force him to experience the conflict he's terrified of. And when the group doesn't self-destruct, when the parents don't lose control, David's nervous system experiences a new outcome to an old trigger.
Exactly. He gets a new ending to his childhood script. It's a localized rewriting of his synaptic responses to conflict.
That is so powerful. But for David to tolerate the terrifying vulnerability of dropping his peacemaker defense, the group must possess what Yalom calls group cohesiveness.
That is the absolute prerequisite.
Cohesiveness is like the gravity of the group. It's the sum of all forces acting on the members that compels them to remain in the room even when every single defense mechanism in their body is screaming at them to flee.
It is the exact equivalent of the therapeutic alliance in individual therapy. Without that glue, David isn't going to stick around for the corrective experience. He's just going to bolt the moment his defenses are challenged.
Right. And cohesiveness provides the container for the other profound factors like interpersonal learning, where your distorted perceptions of others are constantly reality tested, and also catharsis.
Now, catharsis is often misunderstood.
Yeah, people just think it means crying or yelling.
Right. But in a group setting, catharsis is heavily modulated by somatic resonance.
What does that mean?
When an individual releases deeply repressed emotional pain, say, recounting a horrific instance of childhood abuse, and they do it while looking into the eyes of 6 other people who are holding their gaze, weeping with them, providing complete physiological regulation through their own calm nervous systems.
That's not just crying.
No, that is not just a release of emotion. That is the rewiring of a trauma response. The solitary weeping of an isolated depressive just reinforces their despair, but the shared weeping of a group member reinforces connection.
And it ultimately leads to what Yalom identifies as existential factors.
Which always sounds so incredibly philosophical for a clinical setting.
It does. But it's really about the brutal acceptance of reality. The group helps the individual realize that no matter how much guidance they get, no matter how much support the group provides, there is an inescapable baseline of isolation in the human experience.
Life is sometimes inherently unfair.
Pain is guaranteed. And ultimately, you must take total responsibility for the execution of your own life.
It's the paradoxical comfort of shared existential dread. The group essentially teaches you that everyone is alone, but we are all alone together.
It's beautiful, really. So we have these incredibly potent mechanisms of change. But as both Corey and Yalom emphasize heavily, a group doesn't just sit down on a Tuesday evening and instantly activate altruism and corrective recapitulation.
Oh, definitely not.
These factors have to be painfully earned through a highly predictable, volatile life cycle. You don't get the magic without surviving the friction.
Most people have heard of Bruce Tuckman's 1965 model for group dynamics.
Right. Forming, storming, norming, performing, and adjourning.
It's a clean heuristic, but Corey maps this out with far more clinical granularity. And he starts before the chairs are even arranged in the formation or pre-group stage.
And the absolute critical function here is the screening process. Because the fantasy is that group therapy is for everyone.
It is definitely not for everyone.
Right. The clinical reality is that putting the wrong pathology into a group can destroy the entire organism. Yalom is very specific about this. He contends that the single most predictive variable for a successful group member is motivation.
Motivation is everything. If a client is highly motivated to examine themselves, they can overcome immense psychological deficits.
But who are we specifically screening out? Because throwing a grenade into a newly formed group is going to shatter any chance of cohesiveness.
You are actively screening out individuals who lack the ego strength to tolerate interpersonal friction without deteriorating.
So who would that be?
This includes individuals in the midst of an active psychotic break, obviously. Highly paranoid individuals who will interpret group feedback as a literal conspiracy against them.
Wow.
And certainly those with severe sociopathic or psychopathic traits, because they will not experience altruism or universality. They will instead view the vulnerability of other members as a buffet of weaknesses to be manipulated.
You have to protect the ecosystem.
Exactly.
So let's say you have a carefully screened, highly motivated group of individuals. They walk into the room for the initial stage, the orientation, or Tuckman's forming stage. The pervasive psychological state in this room is massive unspoken anxiety.
Oh, the tension is palpable.
The core internal monologue for every single member is, am I in or out? Will I be accepted or rejected?
It is an environment of intense ambiguity. Members are engaging in what we call social testing.
Testing the waters.
Right. They are presenting these carefully curated facets of their personality, seeing what is acceptable. They look constantly to the leader for structure, heavily dependent on authority to define the rules of engagement. They are polite, they are superficial, and they are terrified of stepping out of line.
It's the honeymoon phase of a new romance. Everyone is heavily medicating their actual neuroses with politeness.
That's a great way to put it.
You don't mention your severe abandonment issues on the first date, and you don't mention your history of infidelity in the first group session.
No, you do not.
But the honeymoon inevitably crashes into reality. The polite facade cracks, leading us into the transition stage, or Tuckman's storming phase. And this is where groups either achieve greatness or they completely die.
The transition stage is characterized by profound resistance and defensiveness. The initial anxiety about acceptance, am I in or out, shifts into anxiety about control.
So the underlying question becomes,
Top or bottom, who has the power here? The members realize that to actually heal, they are going to have to drop their defenses and their egos panic, so they revolt.
how does that revolt actually manifest in the chairs? Do they just start yelling at each other?
Sometimes, yeah.
Yeah.
But often it's directed squarely at the leader. This is a critical test of the therapist.
Give me an example.
A member might suddenly declare, this group is a waste of time, we just sit around and talk and you don't even give us any advice. I'm paying you to fix me and you're doing nothing.
Ouch. They are directly attacking the leader's competence.
Yes. Or members might start attacking each other, forming rigid factions. The conflict is actually a subconscious strategy to avoid intimacy.
Because if we were fighting about the structure of the group, we don't have to talk about my profound fear of intimacy.
Exactly. It's a smokescreen.
So what does the leader do? Because the instinct for anyone being attacked is to defend themselves. If I'm the therapist, I want to cite my credentials or explain the methodology or just put the angry client in their place so I can regain control of the room.
And if the leader does that, the group is clinically dead.
Really? Just from that?
Yes. If the leader becomes defensive or tries to immediately extinguish the conflict, they are sending a clear, unconscious message to the entire group. It is not safe to express negative emotions here. The leader cannot handle your anger.
And the group will just immediately retreat back to superficial politeness.
And the real work will never happen.
So the leader has to absorb the attack. They have to lean into the resistance.
They do. They might say something like, you are incredibly angry that I'm not providing the answers you want. Let's look at that. How does it feel to be in a room where the authority figure is disappointing you?
Ah. You use the attack as grist for the mill.
Precisely. You bring the conflict out of the shadows and process it transparently. And when the group sees that the leader can survive their rage without retaliating, and when they realize they can express profound anger at each other without the group falling apart, a massive shift occurs.
They cross the threshold.
Into the working stage. Cohesion and productivity.
Tuckman's performing stage. The storm has passed, the structure has held, and now the question shifts from top or bottom to near or far.
Intimacy.
Exactly. It's entirely about the depth of intimacy. This is where the therapeutic factors, universality, altruism, interpersonal learning, are operating at absolute maximum efficiency.
Members are no longer bringing in historical anecdotes from their week to analyze. They are dealing with their immediate reactions to one another in the room.
The communication becomes brutally direct, but highly empathetic, right?
Yes, very direct. If a member is utilizing a victim mentality, the group will confront them on it. Not with malice, but with a shared commitment to their growth. The group has become a self-correcting organism.
However, even in the working stage, there is a lethal threat that Corey and Yalom heavily warn against. Subgrouping. The formation of cliques. You know, 2 or 3 members realize they have similar backgrounds, or they just naturally gravitate toward each other.
Right.
They walk out to the parking lot after the session and start talking. Then they grab coffee. Suddenly, they have an alliance. Why is this so destructive if they're just finding support in each other?
Because it fractures the collective unconscious of the group. Subgrouping drains the therapeutic energy entirely out of the room.
Because the real urgent emotional work begins happening in the coffee shop instead of in the circle.
Exactly. Furthermore, the subgroup develops secrets. They might discuss their mutual frustration with another group member over coffee, but then smile at that person during the session.
And the moment secrets exist, the fundamental trust of the working stage is annihilated.
It's essentially emotional infidelity to the group process.
The mandate isn't necessarily that you can never interact outside the room, but rather that any interaction, any feeling, any judgment that occurs outside the room must be aggressively brought back into the circle and processed in front of everyone.
The group demands total transparency.
Which brings us to the final stage, consolidation and termination, or adjourning. The group, or the members' time in it, must end. And this is not just a logistical wrap-up, right?
No, it is a profound psychological event. For many members, this group is the most intimate, reliable community they've ever experienced in their lives.
So the impending loss triggers immense grief, and often a severe regression.
Yes.
Because if I'm terrified of losing this family I've built, My unconscious mind might decide to sabotage it so it hurts less when it ends. I might suddenly start picking fights in the final weeks, regressing back to the storming phase, just to convince myself I don't need these people anyway.
And the leader's role in this final stage is to relentlessly interpret this regression. They have to guide the members through a healthy mourning process, which is something many clients have never experienced.
You mourn the loss, you review the specific behavioral changes that have occurred, and crucially, you focus on translation.
Translation to the real world.
Right. How does the client take the emotional muscles they built in this highly curated, safe laboratory and flex them in the messy, chaotic reality of their marriage, their workplace, their actual life?
Which perfectly transitions us into the role of the architect. Because we've talked about the leader responding to attacks and managing subgroups, but the actual minute-by-minute execution of group leadership is an incredibly complex tightrope walk.
You aren't just a referee blowing a whistle, and you aren't just another member sharing your feelings. You are managing the matrix.
And the most powerful tool in the leader's arsenal, according to Yalom, is the here and now focus.
Okay, let's break this down. The here and now focus requires a radical shift in how we conceptualize therapy. Traditional individual therapy often functions like emotional archaeology, right?
Right. A client comes in, and the therapist helps them dig through the ruins of their past to find the artifact, the childhood trauma that explains their current depression.
It is highly focused on historical content.
Yes, but group therapy is relentlessly focused on present process. The past is only relevant in how it is being actively recreated in the room at this exact second.
Let's illustrate the difference between content and process, because this is where the magic happens. Imagine a member, Sarah.
Okay.
Sarah is recounting a deeply painful story about how her mother was entirely emotionally vacant, how she always felt ignored and invisible as a child. That is the historical content. In a traditional setting, we would analyze the mother. But how does a group leader using a here and now focus intervene?
The leader ignores the mother entirely and looks exclusively at Sarah's process, how she is behaving in the room while telling the story.
So what do they see?
The leader observes that while Sarah is talking about being ignored, she is speaking in a whisper. She is staring exclusively at her own shoes and physically curling into a ball, effectively shutting out all the other group members who are actually leaning in to listen.
Wow. She is actively engineering her own invisibility.
Exactly. So the leader interrupts the story and says, Sarah, I hear the pain of your history with your mother, but I want to pause and look at what is happening right now. As you talk about being ignored, I notice you are speaking so quietly we can barely hear you, and you refuse to make eye contact with anyone in this circle. You are making it almost impossible for us to engage with you.
And then the kicker.
I wonder if this is how you make yourself invisible in your daily life.
That is breathtakingly direct. You are bypassing the historical narrative and confronting the immediate behavioral defense. It pulls the abstract trauma into a tangible, actionable present.
It does.
But utilizing that kind of intense surgical intervention raises a massive question about the leader's own presence in the room, specifically the ethics and mechanics of self-disclosure.
This is a huge debate in the field.
Because if Sarah is completely exposed, and the therapist is just a blank analyzing wall, it replicates a sterile authoritarian dynamic. But if the therapist starts trauma dumping about their own mother, the group completely loses its rudder.
Right. It is one of the most heavily debated topics in the literature. Yalom proposes this brilliant, highly functional compromise. He suggests that leaders should almost never disclose detailed historical personal information.
So no talking about your own divorce.
Right. Your clients do not need to know about your divorce, your childhood, or your financial anxieties. That burdens the client with the therapist's pathology. However, the leader must be radically transparent about their here and now reactions.
Meaning they disclose exactly how they are feeling in the room in response to the members in real time.
Yes. If a highly intellectual, defensive client is lecturing the group and avoiding emotion, the therapist shouldn't just sit blankly.
What should they do?
The therapist might say, John, as you spend the last 10 minutes explaining the sociological theories behind your anger, I find myself feeling incredibly disconnected from you. I feel like I'm being pushed away. Is anyone else in the group feeling that distance?
You use your own somatic and emotional reaction as a diagnostic tool for the client's behavior. You are modeling vulnerability, admitting you feel disconnected without making the session about your own historical baggage. It's brilliant.
It's incredibly effective.
Now, what happens when you multiply that leadership by 2? because a lot of these intense psychotherapy groups utilize co-leadership, right? Two therapists in the room.
Co-leadership introduces immense advantages. I mean, practically managing the emotional velocity of 8 traumatized people is exhausting.
I can imagine.
With 2 leaders, one can be actively engaging in a deep one-on-one confrontation with a client, while the other acts as an active scanner. They're watching the micro-expressions of the other 7 members to see who is triggered, who is dissociating, and who is holding back.
And psychologically?
Psychologically, it offers a distinct canvas for transference. It often naturally simulates a parental configuration, allowing members to project their specific maternal and paternal conflicts onto the leadership team.
But the shadow side of that parental simulation must be terrifying. If the parents start fighting, the family collapses.
Exactly.
If the co-leaders have unresolved ego conflicts, or if they have differing theoretical approaches that they haven't aligned on, the group will instantly sense the fracture.
The group will actively exploit it. It's called splitting.
Oh, like kids playing parents against each other?
Exactly like that. Highly manipulative or borderline members will intuitively sense which leader is more lenient and which is more rigid, and they will play them against each other. They will align with the leader they find more attractive or sympathetic, creating factions.
So if the co-leaders are not meeting outside the group for extensive debriefing and maintaining absolute unity,
The group will literally tear their professional relationship apart.
which highlights the immense psychological danger inherent in this work, bringing us to the rigid ethical mandates required to operate these spaces. You are putting vulnerable people into a psychological crucible. The absolute baselines of protection are informed consent and confidentiality.
Yes, and informed consent here is far more complex than just signing a waiver saying, I agree to therapy.
Also,
Informed consent in group work requires explicitly educating the client on the unique psychological risks of the group process. They need to know that they will likely experience periods of intense anxiety, that they might feel worse before they feel better, and that they will be subjected to the direct, sometimes harsh feedback of their peers.
you cannot trick someone into a therapy group. They must willingly step into the fire knowing it will burn.
Precisely. And then there's the terrifying reality of confidentiality.
Right. Because in individual therapy, my secrets are locked in a vault governed by the therapist's state license. If they talk, they lose their career. But in a group, what happens in the group is supposed to stay in the group. But there are no state licenses keeping the other 7 members quiet.
That is the ultimate vulnerability of group work. The leader can mathematically guarantee their own silence, but they cannot entirely control the behavior of the members. You are placing your deepest shame in the hands of complete strangers.
So the leader must aggressively establish a culture of absolute sanctity regarding confidentiality.
They have to address any breaches immediately and severely, sometimes resulting in expulsion from the group. But the inherent risk always remains, and the client must be aware of that before they share.
The leader is essentially the architect of a microculture. They are responsible for establishing norms that prevent destructive behaviors like scapegoating, where the group unconsciously conspires to project all their anxiety onto one vulnerable member and attacks them.
The leader has to throw themselves in front of that moving train to protect the target and redirect the group's aggression.
And speaking of culture, that brings us to the final, incredibly complex layer of this architecture, the cultural crucible.
Because the fantasy of the isolated laboratory is just that, a fantasy.
Right. No group exists in a vacuum.
Exactly. The circle of chairs is placed directly in the center of a massive intersecting web of societal realities. The members bring every inherent bias, historical oppression, cultural norm, and prejudice from the outside world directly into the room.
So if a leader operates with colorblindness or ignores cultural context, they're basically committing clinical malpractice.
100%. The literature, specifically the Substance Abuse Treatment TIP Manual, provides a fantastic structural visual for this. The diversity wheel.
Oh, right.
It demands the leader constantly track the intersecting identities of every person in the room, divided into primary and secondary characteristics.
Primary being the profound, unalterable facets of identity. Race, gender, age, sexual orientation, and physical ability.
And the secondary characteristics being the highly influential but potentially fluid aspects of a person's lived experience. Their socioeconomic class, their geographic location, their level of education, their religious beliefs, and their military status.
You cannot begin to understand a client's defensive structure without mapping it across that wheel. Let's look at how this explodes the standard models of group behavior we just talked about.
Yeah, let's look at the cultural friction.
We established earlier that in the transition or working stages, members are expected to challenge authority, to challenge the leader, and to engage in direct confrontational feedback. But what happens when a client's cultural framework strictly forbids that behavior?
It requires immense, nuanced cultural competence from the leader. The texts highlight specific examples. Take a group with members from certain Southeast Asian cultural backgrounds, where deeply ingrained cultural norms often dictate unquestioned deference to elders and male authority figures.
Okay, so if you have an older, traditional Asian man in the group,
Younger members from that same cultural background might sit in complete silence when he speaks. They will never challenge him, not because they are resisting the therapeutic process, but because doing so would be a profound violation of their cultural moral code.
and if a culturally blind therapist attacks those younger members for being defensive or withdrawn, they are literally re-traumatizing them by forcing a Western standard of aggressive individualism onto their cultural identity.
Exactly. Or consider the dynamic with institutional authority. The texts note that some Hispanic or Latino clients, or Black clients who have generations of systemic trauma related to medical and governmental institutions, might view the group leader, especially a white institutional leader, with profound, well-earned suspicion.
Which is completely rational.
Right. If the leader interprets that suspicion purely as an individual's psychological resistance or stubbornness, they completely fail the client. The leader has to recognize the historical reality in the room.
They must acknowledge the cultural context of that distrust and earn the authority, rather than assuming it is granted simply because they hold a degree.
Right. And this cultural tension gets specifically addressed in the Corey text regarding transactional analysis, or TA groups.
Oh, I love TA. TA focuses heavily on injunctions, right?
Mm.
The internal unspoken rules, the shoulds and shouldn'ts that society programs into our minds from birth.
Yes, and one of the most toxic payloads of injunctions comes from gender socialization. Society dumps a suffocating amount of gender-based programming onto individuals.
Men are burdened with injunctions demanding stoicism, hypercompetence, and the absolute suppression of vulnerability.
And women are burdened with injunctions demanding endless accommodation, the prioritizing of others' comfort over their own safety, and the absolute suppression of assertiveness or righteous anger.
And a TA group is explicitly designed to be an arena where those specific cultural injunctions are dragged into the light and dismantled.
Exactly. A woman can use the egalitarian, feedback-rich structure of the group to practice the terrifying act of being explicitly assertive, of refusing to nurture someone else in the room at her own expense.
And a man can use the group to practice the radical act of crying without attempting to fix a problem, challenging the injunction that vulnerability destroys masculinity.
It's a profound unlearning process, but this brings up the most critical philosophical tension in all of group work.
Right, because if the group is a microcosm of society, and everyday society is structured to enforce these toxic injunctions, if society punishes women for being assertive and punishes men for crying, will the group naturally, unconsciously recreate those exact same punishments?
That is the danger, yes.
How does the leader prevent the therapy group from just becoming another room where the cultural status quo oppresses the marginalized client?
That is the highest calling of the group leader. The group will absolutely attempt to recreate the toxic norms of the outside world. If a female member finally expresses rage, the group might unconsciously try to silence her because her anger makes them uncomfortable.
So the leader has to step in.
The leader must intervene aggressively. They must stop the process, name the dynamic, and protect the member's right to break the societal rule. The therapy group starts as a microcosm of society, bringing all that poison into the room.
But through the leader's intervention.
And the group's commitment to the here and now, it must evolve into a safe laboratory, an alternative microculture. It becomes a localized, idealized society where external norms can be explicitly challenged without real-world punishment, allowing the client to build the psychological armor they need to survive the actual world.
Wow. If you consider the sheer scale of what we've unpacked today, it's staggering.
Yeah.
We've moved from the initial architecture, understanding the profound clinical difference between the tune-up of a counseling group and the transmission rebuild of psychotherapy.
We covered a lot of ground.
We really did. We dissected the biological and psychological mechanisms of Yalom's factors, looking at how universality shatters the neurobiology of shame. We explored how the group manipulates the here and now to literally rewrite the corrupted source code of our childhood family dynamics.
We tracked the volatile, necessary violence of the storming phase.
A fragile intimacy of the working stage, and the absolute necessity of a culturally hyper-aware leader who can navigate the matrix of race, gender, and authority without replicating the trauma of the outside world.
It is an intricate, beautiful, and sometimes very chaotic architecture. It requires immense courage from everyone who takes a seat in the circle.
It really does. I want to leave you with one final thought to mull over, expanding on everything we've just discussed. We have spent an hour establishing that human beings are fundamentally neurologically wired to heal in proximity to other humans.
Right.
The mechanisms of altruism, of universality, of somatic resonance, they require the physical presence, the breath, and the eye contact of a group.
But if you look at the macro trend of our current society,
We are experiencing a catastrophic decline in physical community. We are abandoning the messy, frustrating, friction-filled reality of physical groups, community centers, neighborhoods, extended families, and replacing them with frictionless, curated digital isolation.
we are isolating ourselves on individual islands, attempting to self-soothe through screens, utterly devoid of the chaotic, corrective friction of the group.
So the question we have to ask ourselves as a society is this: if we continue to dismantle the physical groups in our daily lives, are we systematically shutting down our species' primary evolutionary mechanism for psychological healing?
It is the defining psychological crisis of our time. We must examine the spaces we choose to inhabit and what we are sacrificing for the illusion of frictionless comfort.
So take a hard look at your own life, because an X-ray might be able to show you exactly where a bone is broken in a sterile room. But the human mind cannot be repaired in isolation. Eventually, you have to risk the friction. You have to get into the muddy waters with other people.